Pelvic anatomy. I love anatomy. It's so important. It's probably why I became a surgeon. Research shows us that if you understand a little bit about your anatomy, you can strengthen your pelvic floor much more effectively. The other thing I love about anatomy, it's a hands-on course. So get your hands ready for some action. Stretch them out because you're going to be feeling some of the bones and other pelvic structures that are all part of the pelvic floor. Let's meet the bones of your pelvis. Think about your pelvis as a box. A box that holds and supports everything inside. The bones form the frame of that box. So let's start with some important bones of the pelvis. We're going to begin at the back of the box and move forward around the front of the box. So at the back of the box, in the center, is the sacrum. It's a flat bone. Below the sacrum is the coccyx. You can feel the coccyx, also called your tailbone. So start by placing your fingers on your lower back. You'll feel your spine. Sliding your fingers further down, you'll next feel the sacrum, which is a wide and flat bone that's a large part of your pelvis. And then continue sliding your fingers further down, and you'll feel the coccyx between the cheeks of your bottom. So now that we have figured out the back center of the box, let's move to the back corners of the box. Here lie the ischial tuberosities. These are sometimes called the sit or sitting bones, and you can feel these by sliding your fingers under each of your bottom cheeks, especially while sitting. Moving to the sides of the box are the bony pelvic sidewall. This is a combination of the pelvic bones and the muscles on the inside. Then moving the fingers to the front and on corners, you'll feel what's called the iliac spine. Finally, moving to the middle of the box is the pubic symphysis, which you can feel just above your genital region. So review time. The pelvic bones that we reviewed and covered include the coccyx over to the sitting bones, up to the pelvic sidewall, to the iliac spines, and then to the center pubic symphysis. Those are the back, the sides, and the front of your box. Did you feel all those? If not, pause the video. Spend some time getting to know the pelvic bones. There it is. Wonderful pelvic floor anatomy. It's amazing how far a little bit of anatomy education can take you. You know, I can't tell you how much I love it when I'm talking to somebody and they say, Dr. Rapp, I'm not sure I'm feeling the squeezes in the correct place. And I ask, where are you feeling the squeezes? And they say, below my pubic symphysis, as an example. It almost brings a tear to my eye when somebody is able to describe things anatomically like that. It's so much better than when somebody says, I don't know, I'm feeling them down there. So you don't have to be an anatomy expert, but a very basic understanding will go a long way. So there you have it, basic pelvic floor anatomy. Please keep your class going. Use those hands to feel these structures, to reinforce, to remember. When you're sitting at your desk, maybe feel your sitting bones. When you're putting on your pants, feel and practice feeling your pubic symphysis. Practice will go a long way.